everyone, and welcome back to my YouTube channel. Today, I'm going to talk about a topic that affects many and can be a quite a pain, literally. So, yes, I'm talking about sciatica, a condition that can cause discomfort and impact your daily life. So, let's shed some light on what sciatica is, its causes, and most importantly, the treatment. So at last, we will talk about at the end of the video, we'll talk about the homeopathic medicines and homeopathic treatment for the sciatica. And along with this, we will talk about the best homeopathic medicines that has been successfully used for the treatment of sciatica. So if you or someone you know has experienced sciatic pain, then this video is definitely for you. So watch this video till end for more knowledge and stay connected with us for more informative videos like this. So let's get started. So firstly, I would like to explain what exactly is the meaning of sciatica. So sciatica refers to the pain that radiates along the path of the sciatic nerve, which branches from your lower back through your hips, buttocks, and down each leg. This pain can vary from a mild ache to a sharp burning sensation, and it is often caused by a compression or irritation of the sciatic nerve. Sciatica most often occurs when a herniated disc or an overgrowth of the bone puts pressure on a part of the nerve, and this causes inflammation, pain, and often some numbness in the affected leg. I hope the meaning of sciatica is clear to you people. Now, next, we'll talk about the pathophysiology of sciatica. Let's talk about it. So, the most common cause of sciatica is herniated disc, as I have already said. So, disc, that is intervertebral disc, is a cushioning pad between each vertebrae of the spine that absorbs the shock. So, pressure from vertebra due to some reasons can cause the gel-like center of a disc to move from its normal position, and this result in the compression or puts the pressure on the sciatic nerve and finally leads to sciatica. Now, next, we'll talk about the clinical features, that is, what are the symptoms of sciatic pain or sciatica. So, sciatica pains can be almost anywhere along the nerve pathway. It is especially likely to follow a path from the lower back to the buttocks and the back of a thigh and a calf region. The pain can vary from a mild ache to a sharp burning pain, and sometimes it can be feel like a jolt or electric shock. It can be worse from coughing or sneezing or sitting a long time. And usually, sciatica affects only one side of the body. And some people also have numbness, tingling, or muscle weakness in the leg or the foot. One part of the leg can be in pain, while other part can feel numb. So these are the symptoms of sciatic pain. So when to see a doctor? So mild sciatica usually goes over time. So call your primary care providers if self care measures don't ease symptoms. Also, call if pain lasts longer than a week and is severe or get worse. So, get immediate medical care for sudden severe pain in the lower back or leg and the numbness or the muscles weakness in a leg. And pain after a violent injury, such as traffic accident or trouble controlling bowels or bladder. So, this is the time when you need to seek the medical advice immediately. Now, next we'll talk about the etiology. That is, what are the potential causes which are responsible for sciatica. So, the causes of sciatica could be mainly the main among these are the follows. First, a disc bulge or herniated disc. So, disc bulge of lower spine can cause pinching, compression, or irritation of the sciatic nerve. And this is the most common cause of the sciatica. Second cause can be degeneration of the spinal disc. So, it is a natural wearing down of the disc between the vertebrae of the spine, and this result in shortening the height of the vertebrae and result in narrowing of the nerve passage base, which is called spinal stenosis. And next cause of sciatica can be stenosis of the spinal canal, that is narrowing. So this can lead to the reduction in the space available for the spinal cord and the nerves. Next cause can be osteoarthritis. So bone spurs can form in spines in old age people and can compress nerves of the lower back. Next cause can be spondylolithiasis. So it is a slipping of the vertebra which makes it is out of synchronization with the one above it. And as a result, there is a narrowing of the opening through which the nerve exit, and the extended spinal bone can pinch the sciatic nerve. Next cause can be piriformis syndrome. So piriformis is a muscle which is a very small muscle that lies deep in the buttocks region. So tightening or spasms of this muscle is called piriformis syndrome that can put pressure and can irritate sciatic nerve. The last cause can be tumors in the spine. So it causes the compression of the sciatic nerve. So these are the potential causes which are responsible for sciatic nerve or sciatica. Next, we'll talk about the risk factors. So, first and the foremost risk factor is age. So, age related changes in the spine, such as herniated disc, bone spurs, are the most common causes of sciatica. Second is obesity. Next is occupation. So, a job that requires twisting the back, carrying heavy loads, or driving a motor vehicle for long periods may play a role in the sciatica. Next cause can be prolonged sitting habit, and last cause is diabetes. So this condition, which affects the way the body uses blood sugar, increases the risk of nerve damage. So these are the risk factors. Now next we'll talk about the diagnosis. So we'll talk about the investigations. What are the various investigations that one can perform in order to diagnose sciatica? So during the physical examination, Your doctor provide your doctor might check muscle strength and reflexes. For example, you may be asked to walk on your toes or heels, rise from a squatting position, and lift your legs one at a time while lying on your back. So pain from sciatica, which will usually get worse while doing these moves. Now test which you can perform. So people with severe pain or pain that doesn't improve with a few weeks may need X-ray. An X-ray of the spine may reveal an overgrowth of the bone that can be pressing on a nerve. Second test you can perform is MRI. So this procedure uses a very powerful magnet and radio waves to produce cross-sectional image of the back. An MRI produces detailed images of the bone and soft tissues, so herniated disc and pinched nerves shown on the scan. Next test is CT scan. So having a CT scan might involve having a dye injected into the spinal canal before the X-ray are taken, that is CT myelogram. The dye then moves around the spinal cord and spinal nerves and making them easier to see on the images. And last test for the sciatica is electromyography, that is EMG. So this test measures the electrical impulses which are produced by the nerves and the responses of the muscles. This test can confirm how severe a nerve root injury is. So these are the various tests that one can perform in order to diagnose sciatica. Now next we'll talk about the complications. So, most people recover fully from sciatica, often without treatment, but sciatica can damage nerves. So, seek immediate medical attention for loss of feeling in the affected leg, weakness in the affected leg, or loss of the bowel or bladder control. Now, next, we'll talk about the treatment. So, what is the ultimate treatment for sciatica? So, yes, we are talking about the homeopathic treatment. Now, we will talk about the best homeopathic medicines that has been successfully used for the treatment of sciatic pain or sciatica. So let's talk about the homeopathic medicines. So homeopathy is very advanced science fully equipped to treat neuralgic, that is nerve pains including sciatica. Homeopathic medicines can treat acute as well as chronic sciatica. Homeopathic medicines which are safe and natural and work on the root cause of sciatica for complete and effective healing and cure. In fact, a homeopathic consultation if taken on time could prevent surgical interventions in cases of sciatica. Now, next, we'll talk about the top grade homeopathic medicines for sciatica. So, first and the foremost medicine that you can see here on the screen is colosynthis. So, colosynthis is a very excellent homeopathic medicine for sciatica of left side. Now, let's talk about it. So, colosynthesis is indicated where a person complains of the pain along the course of the left sciatic nerve. The pain starts in the lower back and radiates down the leg to toes. In some cases, the pain is located in the left hip or pain in the hip radiates to the knee. The pain may be drawing, tearing, shooting in nature. In some cases, it may be lightening, shock-like, or cramping. Pressure applications may provide relief. So lying on the left side also offers relief in some cases, and some person requiring colosynthesis may also get relief from warm applications. Now, second medicine for sciatica is Magphos. So Magphos is recommended for the sciatica of right side. The sciatic pain is cutting, shooting, stabbing, or stitching in nature. Pain starts in the lower back and extend down the right hip, thigh, and the hollow of the knees and leg. Pressure or warm applications may also offer relief, and in some cases, uncovering the lower limbs worsens the pain. Next medicine for sciatica is gnephium. So, this medicine is recommended for sciatica with pain and numbness. It is also indicated where sciatic pains alternate with numbness. Folding thighs toward the abdomen provides some relief. This medicine is also prescribed in cases of sciatica where pain is confined to the calf region, and the feet. Next homeopathic medicine is Brainia alba. So, this homeopathic medicine is prescribed for sciatica that worsens while walking. The slightest motion may worsen sciatica in such cases, so lying down absolutely still provides some relief. Brainia alba is also prescribed when the person feels relief by lying down on the affected side. The hip and the leg of the affected side may feel heavy. The pain is tearing in nature from the hip through the back of the thigh and into the calf. Next homeopathic medicine for sciatica, last but not the least, that is Rustox. So Rustox is a very wonderful homeopathic medicine for the sciatica that becomes painful with rest. Rustox is the ideal prescription. Lying on the painful side would worsen the pain in such cases. Walking or movement of the affected limb offers relief. Along with severe pain, a burning sensation will be felt in the lower limbs. And Rustox also works wonderfully in treating sciatica that arises from lifting any heavy weight. There is a cramp like pain in the leg. The patient has the inability to sit in one position for a longer time. So these are some homeopathic medicines which has been used for the treatment of sciatic pain, or you can say sciatica. Now next we'll talk about some preventive measures. Okay, so exercise regularly. So to keep the back strong, work the core muscles. The muscles in the abdomen and the lower back needed for good postures and alignment. A healthcare provider can recommend activities. Next tip, what you can do is keep good postures when sitting. Next, use your body correctly. When standing for a longer periods, so rest one foot on a stool or small walks from time to time. And when lifting something heavy, let your legs do the work. Hold the load close to your body. Don't lift and twist at the same time. And find someone to help lift heavy and the awkward things. So these are some tips which you can follow if you are suffering from sciatica or sciatic pain. So that's all. In conclusion, I want to say that sciatica can be a challenging condition, but with the right approach, relief is possible. So if you find this video informative and helpful, please give it a thumbs up and subscribe to our YouTube channel and hit the notification bell for more insights into health and well-being. Remember, the path to relief begins with the understanding and seeking the right guidance. Thank you so much for joining me today on this journey to the world of homeopathy. So take care, and until next time, stay well. So see you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from sciatica, then you can contact us for online appointments. On the screen, you can see how to contact us. So that's it for now, and thanks for watching this video.